So one of the areas that we're really very well known for at the Swan Center is breast augmentation. And we've grown to be one of the busiest practices in the United States for this procedure. And I think what really sets us apart is this, that we're known for a really natural, balanced, proportional result, proportional outcome. And we've developed a lot of techniques and tricks and skills, if you will, through the years to be able to achieve that result or deliver that result. Many different approaches to breast surgery, from the incisions to the types of implants that are available. We find that it's much more predictable and safer that we place our patients asleep. This is a procedure that we do in the operating room. It's not a long procedure. It's usually less than an hour or hour and a half or so. We work with a board-certified anesthesiologist who's with you every step of the way to keep you safe and keep you comfortable during the procedure, and to make sure that you're waking up with a big smile on your face and not feeling uncomfortable in any way. The approaches that we use for the most part are from the fold of the breast, from the base of the breast, and it's a tiny incision, about the width of my thumb, depending on the kind of implant, but small, precise. That approach is the one that we found has the best chance of keeping the normal sensation intact to the breast, to the nipple, and breast function too. So for breastfeeding, breast development later on, it keeps all the parts in place. Sometimes we'll use an incision through the nipple, sometimes we'll use an incision underneath the arm. Rare occasions we'll use an incision in the belly button, but those are kind of the secondary choices that are out there. And then from a sculpting standpoint, depends on where we start from, but most of the sculpting, most of the shaping that we do is with the medical instruments in an area underneath the breast muscle. That's where we'll create the breast pocket for the implant. And then we'll do a bit of shaping and sculpting to that area. And the reason that we're doing that is so that we can have a softer contour, a softer slope for the upper part of the breast, a very natural appearance and beautiful cleavage, just to make that décolletage area of the breast look very natural and pretty when everything has had a chance to settle and heal. Different kinds of implants that we utilize to achieve that result. Basically, there's saltwater saline implants and gel implants, silicone implants. They're safe. I mean, those issues have been researched and studied for many, many years. I think breast implants have to be the most studied product on the planet. They were developed in 1960, 1961 out of Texas. The product has developed and been perfected through the years. I mean, if you think about a cell phone, well, we didn't have cell phones back in the 60s, but how they've changed through the years, and breast implants have done that too. Saltwater, still a silicone shell, a silicone wrapper, but filled with saline, filled with salt water. That used to be one of the most popular implants that was out there in the market in the United States. An okay result. You'll feel the implant a little bit more readily. You'll feel the edges or the ripples with that product. The gel implants, the silicone implants, are much more popular today, and they're like gummy bears. That's what we call them. If you cut it in half, you have two implants. It doesn't go anywhere. It's like a big marshmallow or a big gummy bear candy. But in any event, with that technology that's there, they'll change shape just a little bit in size, inside you. Not that you feel, or it's not that sensation that the implant's moving around, but they'll change shape in size just a little bit so that you'll have a bit more distribution of the breast implant below. Still some at the top. Most girls need a little bit of that to add some fullness back. But with that natural shape change in size, it helps the contour to shape a very natural appearance to the breast. And then when a woman would lay on her back, would lay flat, the implant will move just a little bit inside to give us a bit more of that saucer shape, a bit more of that round shape, what a breast would naturally do. And it mimics that characteristic very closely with the way we do the shaping and the sculpting in the operating room. There are some other implants that are out there, shaped implants, that are a little bit more static, a little bit more solid. And we use those for folks that are maybe a touch more borderline for needing a breast lift, a breast elevation procedure that we're trying to accomplish without having to make another incision, another cut, another mark on the breast. And that's a great little compromise or a great little helper implant to allow us to accomplish that. Sometimes when there's a little bit more relaxation, so maybe another baby or two or another year or two of breastfeeding, no matter what we do implant-wise or inside-wise, there's still going to be a little bit more relaxation than we want. So we've developed some very innovative techniques for breast tightening and breast lifting The most popular, which is called a lollipop lift, and that's where there's a small incision around the areola, around the nipple, and then a line from the nipple or the areola to the breast fold. So it looks like a lollipop as you look straight away. And with that technique, we create an inside bra or support system and then cone the breast and drive it up as tall as we can, just to create a very natural, very beautiful look when everything's said and done. So if you're interested in one of these procedures or even just learning a little bit more about cosmetic surgery or aesthetic surgery, we'd love the opportunity to chat with you about those options that are available to you. We have a great team of certified plastic surgeons, anesthesiologists, and an awesome support team of nurses here, many of which have already had these procedures, and they'd love to share their experience with you and bring you into being part of the Swan family. Thanks.